Welcome back to Safia Help Center, where we focus on empowering individuals with special needs through education and support. In today's video, we'll be discussing a common behavior seen in children with autism: hand flapping. Whether you're a parent, teacher, or caregiver, understanding hand flapping can help you better support those in your care. We'll explore everything you need to know, from the differences between normal and abnormal hand flapping, its causes, and how it can be managed. Stay tuned for this comprehensive guide. What is hand flapping? Hand flapping is a repetitive motor movement involving rapidly waving or fluttering of the hands, often seen in children with autism spectrum disorder, ASD, but can also appear in typically developing children. Types of hand flapping. 1. Normal hand flapping, often observed in young children as part of their normal development, usually when they are excited, happy, or frustrated, generally decreases or disappears as the child grows older. 2. Abnormal hand flapping, often associated with ASD, more frequent, longer lasting, and not always linked to clear emotions, can occur in various situations, sometimes without obvious triggers. Hand flapping in autism spectrum disorder, ASD. Why it happens. 1. Stimming. Self-stimulatory behavior. One of the most common reasons is stimming, or repetitive self-stimulation behaviors, which helps regulate sensory input and manage emotions. 2. Sensory processing issues. People with autism may experience the world differently due to sensory processing difficulties. Hand flapping could be a way to either increase sensory input if they are understimulated or block out overwhelming stimuli if they are overstimulated. 3. Communication. It can serve as a nonverbal way of expressing excitement, frustration, or distress in individuals who have difficulties with verbal communication. Hand flapping in autism spectrum disorder, ASD. Normal versus abnormal hand flapping. Normal starts in early childhood, linked to emotions like excitement or frustration, decreases over time, or fades out completely. Abnormal, often more intense, frequent, and can persist into adolescence or adulthood. Unrelated to context, e.g., not linked to excitement or emotional triggers. Can interfere with daily activities and social interactions. Key distinction: the presence of other ASD symptoms such as communication difficulties, restricted interests, and social challenges helps differentiate abnormal from normal hand flapping. Causes of hand flapping in autism. Neurological factors. Differences in brain wiring in people with ASD may lead to repetitive movements as a form of self-regulation. Genetic influences. Certain genes related to neurodevelopment may increase the likelihood of stimming behaviors in people with autism. Environmental triggers. Hand flapping may be triggered by sensory overload, anxiety, or the need to self-soothe. Treatment and management strategies. 1. Behavioral therapy, applied behavior analysis, ABA, focuses on teaching individuals to replace hand flapping with more socially acceptable behaviors. Occupational therapy helps manage sensory processing issues and teaches coping strategies to deal with overwhelming situations. 2. Sensory integration therapy focuses on improving the individual's ability to process and respond to sensory stimuli in a more adaptive way. 3. Redirection. Teach alternative behaviors or coping mechanisms that can replace hand flapping, e.g. using a fidget toy or deep pressure therapy like squeezing a stress ball. 4. Medication. For severe cases, sometimes medications may be prescribed to reduce anxiety or other issues contributing to repetitive behaviors. 5. Parental guardian involvement. Teaching parents and caregivers how to manage and reduce hand flapping through consistent supportive interventions. When to seek help. What to look for. If hand flapping persists beyond early childhood, becomes disruptive, or is accompanied by other concerning behaviors, social withdrawal, delayed speech, etc., it's a good idea to consult a healthcare professional. Who to consult: pediatricians, developmental psychologists, or specialists